Bell's palsy is a sudden, unexplained paralysis of the facial nerve, affecting thousands of people each year. It can strike anyone regardless of age or gender, and often leads to a dramatic change in facial appearance and function. The exact cause remains a mystery, but viral infections, vascular issues, and autoimmune responses are all suspected contributors. For many, the onset is frightening, impacting not just physical health but also social interactions and self-esteem. In this video, we'll explore the latest research on how to best treat Bell's palsy, focusing on the roles of steroids, antivirals, and the importance of starting treatment at the right time. Let's begin by understanding who is most at risk and why this condition demands a personalized approach. Bell's palsy can affect anyone, but certain groups are more vulnerable. It's seen equally in men and women, and while it was once thought to be most common in people aged 30 to 45, recent studies show another peak in those over 70. Pregnant women and individuals with diabetes, influenza, or respiratory illnesses also face higher risks. The impact goes beyond physical symptoms, often disrupting daily life and social activities. Understanding these risk factors is crucial for early recognition and intervention. As we move forward, keep in mind that Bell's palsy is not just a medical issue, it's a condition that can touch every aspect of a person's life. Precise cause of Bell's palsy remains elusive, but several theories exist. Viral infections, especially herpes simplex virus (HSV), have been detected in the nerves of affected patients, suggesting a possible viral trigger. Other suspected causes include vascular problems, autoimmune inflammation, and even hereditary anatomical differences. This complexity makes treatment challenging, as the underlying cause may differ from person to person. Recognizing the potential role of viruses has led researchers to consider antiviral medications as part of the treatment plan. Next, we'll look at how treatment guidelines have evolved in response to these findings. Over the years, the recommended treatment for Bell's palsy has changed. In 2013, guidelines favored steroid monotherapy, as steroids help reduce nerve swelling and inflammation. Antiviral drugs alone were not recommended at that time. However, later studies produced mixed results. Some research suggested that combining steroids with antiviral agents could improve recovery rates, especially in severe cases, while others found little added benefit. This ongoing debate highlights the need for more personalized treatment strategies, taking into account the severity of the condition and individual patient factors. Let's explore how these treatments are actually administered in clinical practice. Clinical settings, all patients with Bell's palsy typically receive oral steroids, either alone or combined with antiviral agents like acyclovir or famciclovir. The standard steroid dose for adults is 80 mg per day for 4 days, followed by a gradual reduction. For those with lower body weight, the dose is adjusted accordingly. The degree of facial paralysis is measured using the House-Brackman HB grading system, and patients are followed for at least 6 months to assess recovery. Electroneurography, ENOG, and electromyography, EMG, tests help predict outcomes with better results linked to less severe nerve damage. Next, we'll see how these treatments compare in real-world recovery rates. Comparing treatment outcomes, the study found that patients who received steroids alone had a higher recovery rate, 86.32%, than those who received both steroids and antivirals, 79.25%. This was especially true for patients with mild to moderate symptoms. However, for those with severe Bell's palsy, combined therapy showed potential advantages, particularly if started early. These findings suggest that while steroids remain the cornerstone of treatment, adding antivirals may be beneficial for more severe cases. The choice of therapy should be tailored to the individual's initial severity and overall health profile. Timing plays a crucial role in Bell's palsy recovery. The study revealed that starting steroid treatment within 72 hours of symptom onset led to the best outcomes, especially for those with severe symptoms. Interestingly, for patients with mild to moderate symptoms, starting treatment after 72 hours was also associated with high recovery rates. This challenges the traditional belief that earlier is always better and suggests that there may be more flexibility in the timing of treatment, particularly for less severe cases. However, early intervention remains critical for those with more severe presentations. Beyond treatment type and timing, several other factors influence recovery from Bell's palsy. Younger patients, especially those aged 20 to 39, had the highest recovery rates. Electromyography (EMG) results were also highly predictive. Patients with favorable EMG findings recovered better. The presence of diabetes or hypertension did not significantly affect recovery, but these conditions were more common in patients receiving combination therapy. These insights highlight the importance of a comprehensive evaluation, considering age, test results, and comorbidities when planning treatment. Main takeaway from recent research is the importance of individualized treatment for Bell's palsy. Steroid monotherapy remains highly effective, especially for mild to moderate cases, and should be started as soon as possible. For severe cases, adding antivirals may offer additional benefits, particularly if therapy begins early. The timing of treatment, patient age, and EMG results all play significant roles in predicting recovery. As research continues, the goal is to refine these recommendations and ensure that every patient receives the most effective, personalized care possible.